So my name is Jan Ward. I'm a pharmacist at the Midlands and Lancashire CSU. You might be already aware that the CSU has been commissioned by NHS England to support the implementation of the Smoking Cessation Service. So I am part of a small team of 4 pharmacists who are responsible for different regions across England, and I'm the point of contact for the Northwest region. Could I have the next slide, please? So I'm going to give you a background on the Smoking Cessation Service, and I'll also talk about the pilots whose findings were used to commission the service. I'll also give you an update on the implementation status, and then I'm happy to take questions at the end. Could I have the next slide, please? So I'm sure you're all aware of the NHS long-term plan, which focuses on the importance of preventing avoidable illness. We all know that smoking is one of the biggest avoidable causes of disease and premature death. And so treating tobacco dependency has been specifically identified as a key intervention that can contribute towards preventing avoidable illness. So prevention is a core component of the NHS long-term plan, which sets out clear commitment for the NHS's contribution to tackling tobacco dependency. And it states that by 2023-24, all people admitted to hospital who smoke will be offered funded tobacco treatment services, and that includes acute, maternity, and mental health services. The commitments are designed to be the NHS's contribution to helping deliver a smoke-free generation, to build on the good work already being delivered, and to complement current stop smoking services, focusing on both physical and mental health services, and to introduce a level of national direction, but with the local development and delivery. Could I have the next slide, please? So previously we've had smoking cessation program in the community, but the involvement of community pharmacy has been variable. We all know, we're aware that the hospital tobacco dependency services are using the Ottawa model for smoking cessation to support the delivery of the NHS long-term plan. And for those who are not familiar with the Ottawa model for smoking cessation, it involves systematically identifying patients who smoke when they are admitted into hospital. And this is followed by brief, individualized bedside counseling, timely NRT or pharmacotherapy, and then the patient is followed up after they've been discharged. It is a 12-week program, and it's been proven to increase the 1-year quit rate by 11%. And when fully implemented, it's expected to save the NHS 85 million within a year. So I think you'll agree that's a considerable cost saving to the NHS. Could I have the next slide, please? So the aim of the service is to support delivery of the prevention ambition in the NHS long-term plan, and for community pharmacy to become a nationally available choice for patients to access smoking cessation support post-discharge. So it's not to replace locally commissioned services. It's to add additional capacity in the smoking cessation pathway and to increase patient choice. Could I have the next slide, please? So the Smoking Cessation Service is an advanced community pharmacy service. So it forms part of the community pharmacy contractual framework. And it follows on from the Smoking Cessation Transfer of Care pilots, which started October 2020, with the first pilot site being the Royal Oldham Hospital that made referrals to 12 community pharmacies in the Oldham area. The pharmacies were selected following an expression of interest process, and it was important that the pharmacies gave good geographical coverage and also provided extended opening hours. There was a second pilot site down south working with Guy's and St. Thomas's Hospital and King's College Hospital. I should mention that the findings from the pilot were used to inform on what the nationally commissioned service would look like, and that the pilot sites have all now transitioned into the Smoking Cessation Service. Could I have the next slide, please? So I mentioned the Oldham pilot, and this is the data from that pilot. 201 patients were referred and 81 enrolled in the pharmacy's Smoking Cessation Service. And this equates to a conversion rate of 40%. And this is actually in line with the numbers that we're seeing enrolling in the locally commissioned service. The 4-week quit rate was 57%, and this is really, really positive outcome. And it was actually slightly higher than the locally commissioned service. And 19 patients completed the 12-week program, and that equates to a 12-week quit rate of 23%. Should mention that 41% of patient recording a quit at 4 weeks went on to record a quit at 12 weeks. So this is really positive findings, and demonstrate that community pharmacy are very capable on delivering on outcome just as well as a locally commissioned service. I should also mention that the pilot also demonstrated that the referral pathway to community pharmacy was acceptable to patient. So that's really important. Could I have the next slide, please? So we've had the pilots and obviously really good findings, and that transition into the Smoking Cessation Service. And this led to a number of things, such as the standard treatment program was developed with the NCSCT, and the service funding was agreed. So the consultation fees are paid for nationally and come from the community pharmacy contractual framework, whereas the NRT costs are charged back to the ICB and come from the primary care indicative prescribing budget. Also developed was a service specification, and this was actually revised June last year. And the key change there is now pharmacy technicians as well as pharmacists can deliver the service. And the service was launched to coincide with the National No Smoking Day on the 10th of March 2022, and with pharmacy registrations opening the same month. The launch was an intentional soft launch, and that took into consideration that trusts were all at different stages of implementing their inpatient services. Could I have the next slide, please? So I mentioned earlier that I work for the Midlands and Lancashire CSU. And so our role in the implementation has really been around scoping and mapping, trying to understand the exact position of each acute trust in terms of delivering the relevant parts of the NHS long-term plan. We inform planning, and we help to identify key stakeholders to support working groups. We facilitate implementation at local levels, and advisors such as myself are available for each region across England. And we've ensured that pilot sites have transitioned successfully and engaged with early implementers, and those sites looking to start delivery imminently. Our team has also produced supporting documents and promotional material, and all these can be found on our website. Could I have the next slide, please? So we often get asked, what is the process for a trust to go live with the Smoking Cessation Service? Well, the answer to that, it's a three-stage process, and it's demonstrated on this diagram. So stage one is scoping and mapping. So this is where we try and identify key contacts at the hospital and arrange initial meetings. And during those discussions, we would aim to get an intention from the trust to implement the service. So once we have that, then it is very important we have the right sort of people around the table to form working groups. So this might include, obviously, the acute trust, but you might have public health, or ICB, the community pharmacy clinical leads, and also locally representative from the locally commissioned service. And so when we have our working groups set up, then we move on to stage two. It's important that we understand and establish a referral pathway to community pharmacies, as well as a referral method. At the moment, there are two options, really. There's PharmOutcomes and NHS Mail. And so once the trust have got the pathway and agreed on a referral method, and also we would hope that they would also have a go live date. So once we have that date, then we move on to stage three, and that's why we are here tonight. So East Cheshire Trust is going to go live on the 8th of April. So it is really important we engage with yourselves to make sure that you're service ready, you've got your accredited staff in place, and carbon monoxide monitors also ordered. And also we look at geographical coverage. And where we don't have good coverage, we would seek the support of the LPC. Could I have the next slide, please? In terms of the referral pathway, so you have hospital inpatient undertaking a supported quit attempt. And upon discharge, there'll be a conversation with the tobacco dependency advisor, and the patient will be given a choice either to continue their smoking cessation treatment with the locally commissioned service or community pharmacy smoking cessation service, or the patient may opt for self-care. In that case, there's no transfer of care required. But the important point to make here is that it is important that referrals are equitable between the locally commissioned service and the pharmacy, community pharmacy smoking cessation service, and should be the patient choice where they want to continue their smoking cessation treatment. Could I have the next slide, please? In terms of a model of care, and this was taken from the original service specification. So we have at step one, a patient's admitted into hospital and identified as a smoker. We move on to step two, with the patient consent, tobacco dependency treatment is initiated. And upon discharge, we move on to step three. There's a conversation, assuming the patient selects a registered pharmacy of their choice, where they will continue their smoking cessation treatment. So then a referral has to be electronic, secure referral in line with the service specification is sent when they've been discharged, will be sent to the pharmacy. And at the moment, I believe East Cheshire Trust is looking to use NHS Mail. But I think Dave will probably give you more an update on that. So the referral is sent to pharmacy. So that's step 5. The pharmacy, whether it's the pharmacy technician or the pharmacist, has to contact the patient within 5 working days of receiving that referral. If you fail to make contact the first time, you must make at least 3 attempts, with the 3rd attempt being on the 5th working day. And that's to make sure that the patient doesn't run out of their NRT. However, if you fail to make contact with the patient, you must inform East Cheshire Trust before you close that referral. So assuming that contact is made, so we move to step 6. And obviously, if contact is made and the patient declines to take part in the service, then again, you have to let the trust, the referring trust, know before you close that referral. So let's assume the patient consents. So they then transition fully into the smoking cessation program. And you can offer the patient either face-to-face or the consultation can be remotely via telephone or video link. And when you have the first consultation, then you would agree an appointment cycle with the patient. And it's important the appointment cycle overlaps with NRT supply so that the patient doesn't run out. And you can make a supply for up to 2 weeks supply of NRT. And also, obviously, the advantage of seeing a patient face-to-face is that you can undertake carbon monoxide monitoring. And that's a good way to validate the self-reported smoking status. And then we move on to step 7, post-event messaging. So you are required to provide the referring trust with patient-level outcome data. And also you need to notify the GP when the patient has enrolled in the service that you're providing the service for their patient. And then at the end of the program, let the GP know whether their patient has had a successful or unsuccessful quit attempt. All the information that's required for post-event messaging is all outlined in the service specification. Could I have the next slide, please? In terms of training, so whether it's a pharmacist or the pharmacist technician, you must undertake the NCSCT, Stop Smoking Practitioner Certification. And when you are a certified practitioner, you then must undertake the specialist modules in order to support pregnant women or people with mental health problems. You also have to undertake the NCSCT module on using e-cigarettes. Although the supply of e-cigarettes or vapes is outside the scope of this service, you're able to provide behavioral support to patients. So that's really important. So early on, I mentioned the standard treatment program. So I really recommend you read this. It really is an important document, and it just gives your consultation a more structured approach, and also the evidence-based behavior change techniques that are going to give your patient a really good chance of quitting cigarettes. You also have to be competent in undertaking carbon monoxide monitoring, and also be familiar with the SOP for service provision. Could I have the next slide, please? So to summarize, the service is to complement existing locally commissioned services. It's not to replace them. You can see inpatients that have been referred to you by the acute trust who wish to initiate or continue their quit attempt after they've been discharged. And you must contact the patient within 5 working days of receiving the referral. And if you fail to make contact the first time, you have to make at least 3 attempts before you close that referral. And you have to also notify the referring trust. So you can provide support up to 12 weeks. And the consultations can be delivered either face-to-face or remotely. And you can supply NRT at least 2 weeks supply, up to 2 weeks supply at a time. And this can be from the approved list, which can be found in the drug tariff. Have the next slide, please. So you have to make a clinical record for every activity pertaining to the service. And you have to undertake carbon monoxide monitoring for face-to-face consultation. This is really important for the formal reviews at 4 weeks and at 12 weeks. And the service is completely exempt of charges. So the NRT can be supplied free of charge, even if a patient pays for their prescription. You're required to make patient-level outcome data to the referring trust as well as GP, patient's GP. And in terms of fees, it's £1,000 setup fee, and then there's a £30 for the initial consultation, £10 for interim consultations, and £40 for the last consultation, which can take part. Can be any time from week 4 to 12. And you can submit claim for payments via the MYS. Can I have the next slide, please? So just quickly, implementation update locally. So in Cheshire Merseyside, currently there are 7 trusts that are live with the service. East Cheshire is going to go live on the 8th of April. And we've got 2 remaining trusts that have engaged with us and are working towards implementing the Smoking Cessation Service. Could I have the next slide, please? So in terms of pharmacy registration, and this map is taken from the dashboard, which can be found on our website. The dashboard is just a guide. It's not 100% accurate. It gives you implementation status of trust as well as pharmacy registration status. So we can see around Macclesfield, we've got good geographical coverage. Could I have the next slide, please? So some useful references here, including the service specification, the dashboard I mentioned, which can be accessed by our website, and also that standard treatment program that really I would recommend that you go and really read that. And could I have the next slide, please? And that brings me to the end of my presentation. Thank you.
Thanks, Jan. So I'm going to pass you guys over to the representatives from the East Cheshire Trust, who are just going to go through some slides with yourself. And then what we're going to do is we're just going to run through a few key points at the end, and then we're going to go for questions and answers as well. Okay, so I'll go over to you guys.
Hi there, I'll go first. My name is Mondrali. I'm Deputy Pharmacist at East Cheshire NHS Trust, and I've got my colleague here, Dave Nuns. I'll let Dave introduce himself.
Evening, everyone. I'm Dave Nuns. I'm the Associate Director of Strategy, and I've been leading on the establishment of our treating tobacco dependency service.
Next slide, please.
So we're here tonight to talk about the launch of our treating tobacco dependency service, but I did want to kind of place it with some wider commitments that we're making as a trust towards supporting people to give up smoking. So we've recently signed up with the NHS Smoke Free Pledge, which is endorsed by the Action for Smoking on Health, as well as those national bodies, the Royal Academy, the Royal Colleges that are listed there. And by signing this, we've kind of agreed to kind of endorse a new smoke-free policy, which we've refreshed our policy, actively work with the local authority and the public health department around kind of supporting smoking cessation, and implementing the new process around kind of supporting treating tobacco dependence, making sure that patients have got access to the medication they need. We're about, I think, as Jenna kind of mentioned earlier on, we're about to launch our inpatient service. April the 8th, we're aiming to launch the service. It's going to be support is going to be predominantly aimed at inpatients, although we are in discussion with the local authority as well around supporting some outpatients, possibly with the uptake of vape services, but at the moment it is just for inpatients. It's important to say that we've been supporting pregnant women and their partners for some time now with the Saving Babies' Lives bundle, so this new service will enhance that. And it's also important to say that we've been working with Mid Cheshire Hospital's NHS Trust on this new scheme. They've been running their treating tobacco dependency service for some years now, with some success. So we're able to kind of plug into everything that they've learned in terms of what works in terms of talking to patients, encouraging them to quit, and supporting them along that quit journey. And we're also working closely with Cheshire East Council, particularly the Public Health Department. They've provided some funding for this scheme, and it's in recognition of the support the council want to give to kind of to tackle this issue. If I can have the next slide, please. So yes, so we've received funding from the ICB for this. And from Cheshire East Council, we're initially able to set it up for the first 12 months. It's going to be one of the smallest schemes. So when Jan showed that slide of which hospitals are already offering a service, some of those have got several staff working on this. As a small trust, we're only able to employ one whole-time equivalent. We're going to have 2 part-time staff working on this, so we'll hopefully provide a service all year round. We'll be able to cover for any sickness absence or any annual leave. And it's a combination of things that we're going to be able to support people with. So yes, nicotine replacement therapy, so the kind of nicotine replacement drugs that we're talking about this evening, but also support within that inpatient spell. We're going to be able to give advice and counselling. And we're going to be able to provide them with NRT whilst they're in hospital. And for those people who want support to quit, they want onward referral to a community-based service or a pharmacy-based service, we will provide them with 2 weeks' worth of supply once they're discharged. As I said before, this is in addition to the service that we offer to our expectant women. In terms of a process, we don't yet have a digital clinical system within the trust, but that will come in later in the year. So we are reliant on kind of clunky computer systems and paper-based systems, but we will seek to identify all smokers when they're admitted. Probably about 90% of our admissions come via A&E, and about 10% are elective. So we're looking at about 11,000 patients a year, of which we think 15% of them will smoke, but we do not expect to reach all of them. There will be people who aren't asked the question when they're admitted, or the correct kind of templates on the computer systems will be completed. This will improve later on in the year when we adopt our new clinical digital system. Hopefully, when we do identify smokers, they'll be referred to our in-house treating tobacco dependency service. Obviously, the number of people who agree to that will depend on the VBA, the very brief advice that we give. So we're going to work with all of our kind of ward teams, our nursing teams, and our doctors on those admitted wards to try and improve the quality of that very brief advice, to encourage people to take up the offer of support. Each patient, whilst they remain in hospital, will be visited. they'll be given support, discussion, advice. They'll be offered counselling, and they'll be offered NRT. If for whatever reason they've been discharged before our member of staff gets a chance to see them, we will follow people up with a phone call, and that might mean that we don't issue them with NRT, but we do make an onward referral either to community pharmacy or to community-based stop smoking service. And like I said, we will offer that onward referral to everyone who's been seen. Experience from elsewhere is about 50% of people who attempt to quit whilst they're in hospital do accept that offer of an onward referral. And like I say, if we do make that referral, we will make sure that when they're discharged, they're given 2 weeks supply of NRT. So I think that's if we go to the next slide, and I think Monjo is going to pick up this some technical things about NRT drugs.
So I'll just quickly give you a bit of a focus on our NRT supply. So I've just listed on the slide the full list of preparations that we'll be stocking, and these are synchronized to the packs that we've been using for our pregnancy for our pregnant patients. So all these preparations, they are listed in the drug tariff and they match the drug tariff lists. So our treating tobacco dependency specialist nurses will keep a supply of these on them. And so they will directly supply to the patients when they visit them on the wards. And they'll provide up to about 2 weeks supply to the patients on discharge from the hospital. And during the consultation with the patient, the specialist nurse will devise a follow-up plan for discharge with the patient, discuss their NRT supply needs, and give them advice and advise them how to obtain further supplies on discharge. And we do envisage most patients be referred to a community tobacco addiction service, who will then carry on the ongoing supply. Next slide, please. So on this very busy process map, we've tried to illustrate how it will work for us for the inpatients in the hospital. So once a patient is admitted in the hospital, they'll be seen by the doctor, who will then complete the clerking in. And during this clerking in process, they'll identify whether the patient's smoking. And they'll document this in the clerking pro forma. The ward clerk on the ward will identify this, and they'll update a system called PCS with this to identify the patient as a smoker. And this will then generate a report to the specialist nurses, who will then identify the patients on which ward that they're on. They'll add this to their work list. They'll visit the patient on the ward. If the patient's been discharged by the time they arrive on the ward, they will follow up, as Dave mentioned, with a telephone call to the patient and arrange the NRT supplies, etc. Outside. For inpatients, the TDD nurse will visit the patient on the ward. They'll document in the medical notes what they've discussed with the patient. They'll document the outcome on EMIS. They will they'll either supply the patient NRT or order this from pharmacy, the inpatient pharmacy. So once the patient is ready to be discharged from the hospital, they'll discuss ongoing support. They'll discuss with the patient whether they want to continue this course of NRT. If the patient declines, they're discharged without. If they wish for ongoing support, there's a couple of options. If the patient's from outside the area, the nurse will complete a referral and send this via email to the patient's locality. If the patient is within an area, they can either be referred to 1U East Cheshire Services via email, or will refer the patient to a local community pharmacy of the patient's choice via PharmOutcomes, which I'll discuss in more detail in the next slide. So next slide, please. So just a few points about PharmOutcomes. So we've decided to go for PharmOutcomes for the referrals. It's a better, safer, more reliable way than email. We had a quick look at this system, which we're already using for our discharge medicine service. It's quite an effective system to use. We've made quite a lot of referrals for the DMS service already. And I've had some demos with the PharmOutcomes developers, and it's very easy to identify which chemists are involved in the smoking cessation services. And it's quite easy to complete referral to them. And for us as well, it's good to be able to generate reports and see the outcomes of the patients once they're referred, to see if they have quit and completed the process. We will be using EMIS to document internal notes, which is very useful for GPs who they can view any consultations, etc., between the specialist nurse and the patient on the wards. At discharge, we use EDNF for electronic discharge letters at East Cheshire NHS Trust. So we have made some quick easy NLT documenting sections on the letter, so that any pharmacists or doctors who complete the discharge letters can document what NLT was supplied to the patient on discharge and document how much is supplied on discharge. And this will appear on the drugs list or on the changes to medication section on the letter. And finally, we've just listed our email address here on this slide. So this will be the key contact email for contacting the specialist nurses at the trusts. If you have any questions or if you find any further details from the specialist nurse, this is the email to contact them on. Next slide, please. Oh, that's all for me. Thank you.
So back over to me. Sorry about that. I was on mute. So thank you very much for the update there. We just want to run through a few key points to remember in relation to the SES service and going forward. Just for you guys within the community pharmacy, it's really important that on a receipt of referral, you must contact that patient within those 5 working days. And as I say, with that referral, you need to make sure that you contact them on at least 3 occasions if you're not getting an answer, and the final attempt must be made on that 5th day. Also, as well, before you close that referral, as we said earlier, you must contact the team, and that would be on that email address that has been provided there. So it would just let them know before you actually close the referral down the status of that referral as well. So it is really important you let them know if a patient isn't ongoing with that service. Also as well, it's really important that as part of the service, you must ensure you record and share the outcomes of each 4-week consultation and 12-week, and that will be made to the tobacco dependency team on that email address above. But it's also vital that you contact that patient's GP as well to let them know of those 4-week and 12-week outcomes as well. As we said before, the service is completely free of charge to all patients who are referred, and that will be for the full 12-week duration of treatment. So any patient that is referred, even if they are a patient who pays for their prescription, they will still receive this service free of charge, and they will receive their NRT free of charge as well. So all patients are exempt from charge for this service. As Jan was saying earlier, you can run this service face-to-face, and where you do have patients who aren't able to attend face-to-face, then this can be done remotely via video or telephone consultation. These are for patients who can't attend. So as we know, patients who are being discharged from hospital, they may have been in for ongoing treatment and they aren't able to get out to the pharmacy. So it's about making sure that we can, identify those patients and we can still offer them that service, and relatives can come in and collect NRT supplies, or alternatively, if your pharmacy is able to deliver, that is something that you could discuss with the patients as well. And as I say, the service can be provided by trained pharmacists and trained pharmacy technicians. So it's all about finding a way that works best for you guys within your established pharmacy and your team, and seeing, making sure that you're utilizing the skills that you've got within your pharmacy as well. So working with your technicians to make sure they've got everything that they need to be able to provide this service going forward. It's really important as well that all staff within the pharmacy have access to PharmOutcomes and to NHS shared mail, and that is consistently checked throughout the day, because that's how you're going to receive all of your referrals and all of the information from ourselves as well. It will either come to you via PharmOutcomes or the information will come to you on NHS shared mail. So it's really vital that everyone within the pharmacy has the ability to be able to check that shared mail account, so having their login. And if anyone needs any assistance with that, please don't hesitate to contact myself, and I will be able to assist with that as well, getting people linked to the shared mail accounts. It's really important as well that all staff, even if they're not going to be, working on this service, that they have a full understanding of how the service works. And this helps eliminate gaps in service. For example, when you've got a locum if all your staff members know how to deliver that service and what that service entails, then they will be able to work with that locum pharmacist as well, and they will be able to answer any questions that they may have about the service. So it's really, really key that all our staff within the pharmacy have a complete full understanding of how the service works, how it's going to run within your establishment. We always say have a booking system in place, and this gives you a key identifier to see when your next patient appointment is. It also gives you the opportunity to prioritize your workloads as well. If you know you've got patients coming in at 2 o'clock for, you know, a consultation with yourselves for an SES referral, it's to make sure, you know, when that patient arrives, you know, you can service that patient and they're not waiting round for yourself as well. So it's really, really key to making sure that we have got a booking system in place. As I said before, if all staff have got access to NHS Shared Mail, you can use this on your Outlook. There is a calendar available on there. You can book in appointments, and anyone who has access to that Shared Mail account can log in and see that calendar. So it means anyone, you know, for example, returning from holiday, they've been off for a week and they want to see what appointments they've got scheduled for next week. You know, locums who, you know, work intermittently, they may, you know, work a couple of weeks and then they're going home to another country and coming back. It just gives them a chance to see what's in your diary to get preparation as well before attending your pharmacy. So it's really, really key that we are utilizing those systems that we've got in place for booking those appointments as well. And that takes us to the end of the presentation. So we're just going to break now, and we're just going to be here to answer any questions that any contractors may have about the service. And you can either put them into the chat function, or there is a Q&A where you can ask questions, or I know you are able to unmute yourself because I've made that facility available, so you can unmute yourself and just ask any questions that you may have as well. And I just want to say thank you very much to all our speakers this evening for attending and working with ourselves on this project. And I want to say thank you as well for all the contractors that are attending and are watching this on our platform. If you've got any questions, please don't hesitate to contact myself or anyone within the CPCW team. All our details are available on our website, and my email address, should you want to contact myself, is Sarah, spelt SARA, at cpcw.org.uk. So thank you very much for your time, and we're just going to go over to any questions that we may have from anyone else on the floor. Thank you.
Sorry, Sarah, I've got my hand up.
Yeah.
I just wanted to add that I think it's really important that pharmacy have got the trust email address, because obviously it is important to communicate with the trust when, for example, if the pharmacist is providing the service and they're off sick or they go off on holiday, and for some reason there is no accredited staff during that period, to use that email to let the trust know, so that the trust then knows to hold off sending any referrals, because obviously they're not going to be actioned during the absence of the accredited pharmacist. So that is really important, to use that email address to communicate any changes that might, you know, mean that referrals are not going to get actioned. Thank you. Covered everything then.
Yeah, so as I say, thank you again for attending. You're more than welcome to sign out and get, you know, the extra 10 minutes back in your diary, because we all know how crucial time is at the moment for everyone in the industry. So thanks again for your attendance. And as I say, if you do have any questions, feel free to contact myself, Jan, and also as well, I'm sure there'd be no problem with you contacting the trust if you had any questions to ask the team as well. So thanks very much, everyone. Take care.
Thank you.
Thank you.
You're very welcome.